Hey there! It's good to see you again. How are you? How have things been going? Pretty good, more or less? That's good to hear. Everything's felt okay since we made those corrections to your heart? That's fantastic. I'm so glad to hear that. Don't forget, if you start to feel those symptoms coming back, we can definitely make some adjustments so that you stay in tip-top shape. But, for now, let's take a look at why you're here today. Interesting. Very different symptoms from the last time I saw you. It says here that you've been experiencing racing thoughts. How often would you say you're having those? Oh, so pretty frequently. Okay. Is it fairly consistent all the time, or do you notice it gets worse at certain times of day, like right away in the morning or late at night? All right. Would you say those thoughts are mostly positive or mostly negative? Or is it a mix of both? Mostly negative. Got it. It also says you've been feeling restless. Can you give me a little more detail on that? Finding it hard to sit still. Hard to focus on tasks. Does that get worse as your racing thoughts get worse? Okay, so there's a trend. I figured that might be the case. And let's see here. You've just been experiencing a lot of anxiety in general? Would you say it's just a general feeling of anxiety, or have you been experiencing moments of heightened anxious feelings? Panic attacks, anything like that? Yes, got it. All right. Has anxiety been an issue for you in the past? Not to this degree. Okay. On a scale from 1 to 10, how anxious would you say you're feeling right now? Okay. Well, I think I have a good idea of what's going on, but just to make sure, I'm going to do a brief physical exam. Are you okay with that? Perfect. I'm just going to get started by listening to your heart. Just breathe normally for me. Okay. Now, I'm going to check your eyes. Please just stare straight ahead while I move this light back and forth. Good. Now, can you follow the light for me? Just with your eyes. Keep your head still. Okay. Now, I'm just going to take a quick look in each of your ears. First, the right. And the left. Oh, yeah. So, would you like the good news or the good news? Well, it depends on how you look at it, but I was definitely able to confirm what it is that's going on. You seem to be suffering from an acute case of bad brain. Yep, bad brain. Basically, the part of your brain that makes you worry and causes anxious thoughts is working in overdrive, which is why you've been feeling the way that you have. No, believe me, you didn't do anything wrong to cause this. Let me reassure you, you are definitely not alone in what you're experiencing. Your symptoms are some of the most common ones I've seen in patients, so there's no need to panic. Bad brain, unfortunately, is a very common condition. I can't even tell you how often I've seen people struggling with it. But that brings me to the other piece of good news. It's very easy to fix. Oh yeah, super simple. It's another one of our clinic's specialties, and I've performed the procedure more times than I can count. Yep, a quick little procedure, just like the work we did with your heart. Local anesthetic, topical serum, the whole 9 yards. I would just need to take a look around inside that head of yours and correct any problems causing the bad brain symptoms. Any work I do will be completely painless, I promise. Would you like to go ahead and have that done today? All right, perfect. I think you'll be feeling a lot better once we get in there and patch you up. Okay, first things first, I'm going to take a quick x-ray so I can see exactly what we're working with here. Oh, yeah, the tools we use here, like the otoscope and the ophthalmoscope, are specially designed to help us see the general signs of conditions like bad brain, but taking an x-ray will help me to see the more minor details. I'm just going to drape this apron over you to prevent any unnecessary exposure. Yeah, even though it's going to be an x-ray of your brain, we can't be too careful. Lights are going off for just a moment. This will just take a second. There we go. All done. Let's take this off of you. Now let's see what you've got going on in there. All right. I'm going to be honest, there is quite a bit of work that we'll need to do, but rest assured it's nothing I haven't seen before. Tell you what, rather than explain everything right now and run the risk of heightening your anxiety right before the procedure, what I'll do is explain everything I'm doing as we're going through it. I'll make sure you understand everything that's going on, okay? Hey, everything is going to be okay. You're going to be okay. You're in good hands, I promise. You deserve to be able to live life to the fullest, and I'm going to do everything in my power to make that happen. Can I give you a hug? Would that be okay? All right. Let's get you all fixed up. First things first, I'll prepare some of the local anesthetic. Yep, we're still going IV free for this procedure. Just our specially infused chamomile tea anesthesia. This time with an added muscle relaxer, since we'll be working with your brain. Even though what I'll be doing is all very surface level, there is still a chance I could brush up against certain lobes, and we don't need you experiencing any sudden muscle spasms. Just drink that up and you'll be feeling much calmer very soon. And since your body temperature will start to drop as your muscles relax, I'm also going to give you a blanket. And there we go. Nice and cozy. All done with the tea? Perfect. Let me take that from you. One last thing before I get started. I'm going to put this pillow under your head. It'll keep your head propped up so that I can see better, and it should make the whole experience more comfortable for you. There we go. Oh, of course. If you start feeling sleepy, feel free to drift off. It won't affect anything I'm doing. All right. Ready to get started? Okay. I'll start with the serum. I'm just going to apply a layer of this to your scalp and forehead. And in a few minutes, your brain will be exposed enough so that I can work on it. Feeling okay? It's not too cold, right? Okay, good. We try to keep the serum at a comfortable temperature so that you don't start the procedure feeling uncomfortable. All right. That should do it. You might start to feel a tingling feeling in your head, but it shouldn't be unpleasant. Still doing okay? Oh, yeah. You look so much more relaxed already. That tea is definitely doing its work. And so is the serum. I'm just going to grab my tools. Wow. You have a beautiful brain. But I'm sure you hear that all the time. It just needs a bit of a tune-up. I think I'll start with... yes. So what happens when you experience a lot of unresolved anxiety is it starts to form together into a sort of gunk that surrounds your brain and clogs your thought process. And to be completely transparent, you have quite a bit of anxiety gunk in there. So before I get into any more detailed work, I'll need to scoop it out. Ready? Yeah, this has been building up for a while. Definitely a good thing you came to see me today. I think your head and your thoughts will be feeling much, much lighter once this gunk is cleared out. There's a time and a place for anxiety, but once it gets to this level, it's absolutely time for a cleanup. Oh, don't want to remove that. Well, with this much anxiety crowding the brain, normal thoughts can sometimes get stuck in it, and as a result, they turn into anxious thoughts. We don't want to remove the thoughts themselves because you need those, but we just want to remove the worry that's surrounding them. Just a couple more scoops, and we should be good to go. Okay. I'm just going to spray your brain with a bit of cleaner to wash out any smaller bits I might have missed. Perfect. Looking much better already. How are you doing? Still okay? Good. Let me know if you need to take a break, okay? All right, next I'll move on to... Are these? Oh, yeah, these definitely need to come out. Your brain is absolutely covered in intrusive thoughts. Nasty little things that your brain creates just to ruin your day. Gosh, there are so many. No wonder you've been so anxious, you poor thing. don't you worry. I'll be able to get them all removed. It'll just take a little bit of plucking. Now, you might feel a little bit of pulling as I remove each of these, but it shouldn't be painful. There's one. Did that hurt at all? No? Good. Yeah, so what happens with these is that when your mind creates thoughts, they move all around the brain to the different parts in order to help you function in your day-to-day life. Sometimes, though, what can happen is the thought will mutate and become negative or self-sabotaging. Then, instead of moving through the brain like a regular thought, it becomes sticky and attaches itself to the brain in one spot, making it even harder to get rid of. And unfortunately, if you already have a lot of that anxiety buildup, it can make it even easier for these thoughts to form and stick to the brain. No. Remember what I said. None of this is your fault. Not at all. In fact, that is exactly what these little buggers want you to think. They twist your mindset so that you end up thinking less of yourself and blaming yourself for everything, when none of that is actually true. That's why we need to get all of them out and properly disposed of. You don't deserve to have anyone launching all that negativity at you, especially your own brain. Yep. Sometimes we are our own worst enemies. It's just a fact of life, albeit not a pleasant one. That's why I'm so grateful that modern medicine has come such a long way in developing these procedures, so that we can help people struggling with these problems more than ever before. Just a couple more to go. There. That's all of them. Goodbye and good riddance. Oh, you already feel a difference? That's fantastic. Now imagine how you'll feel once the medicine wears off. You're going to feel like a whole new person. Now let's see what else we have going on in here. Just going to use my ophthalmoscope again to take a closer look. Looks like you still have a lot of thoughts racing around in there. Which isn't necessarily the worst thing, but it can lead to more of that anxiety gunk coming back. Let's see if I can find the source. Oh, there it is. Now it's all making sense. Your logic lobe came unplugged. Well, there's a part of your brain called the amygdala. Its job is to process different sensory signals and alert the rest of your body if there's danger nearby. It basically controls all the stress and anxiety triggers that come from your brain. Now, there's a small piece of the amygdala called the logic lobe. It's what helps your brain to recognize things that aren't threatening. But when the logic lobe is unplugged, your amygdala basically goes on hyperdrive and turns everything into an anxiety response. That's why you've been having so many racing thoughts. Your brain isn't able to control itself without that piece properly plugged in. So I'll just reattach it to the amygdala and there we go. That should help tremendously. Your thoughts should begin to slow down and your brain will start to process things in a more logical way instead of interpreting everything as stress or anxiety. How are you holding up? Still feeling okay? Would you be up for one last step before we finish up here? We can definitely leave your brain as is, since all the problems have been fixed or removed, but there's one extra thing I'd like to do just to keep everything in good shape. I'd like to give you some brain booster Botox. It's a set of 4 to 5 teeny tiny injections that go into your brain to give it an extra boost of calmness and positivity. It also helps you to stay clear-headed and relaxed in stressful situations. Yes, it's totally quick and painless. I've actually gotten them myself a few times, and I can say it works wonders. No negative side effects, just a happy brain and a clear mind. Does that sound good? All right, perfect. I already have one of our disposable needles prepared with the injection, so I'm just going to get this ready. Now, like I said, this shouldn't hurt at all. It's just going to feel like 5 tiny pinches, okay? Ready? 1, 2, 3, 4, 5. Done. Not so bad, right? Okay, that should be taking effect within the next 30 minutes or so, and the serum I put on your head will start wearing off soon. In the meantime, I want you to rest, okay? I'll turn off the lights and leave the room so you can sleep, and I'll come back in and wake you up when it's time to go home. You did an amazing job today. Not just with the procedure, but by coming here in the first place. I know it's not always easy to speak up when you need help with your mental health, so I'm proud of you for taking that step. And you should be proud of yourself, too. Now, just relax, drift off to sleep, and when you wake up, you'll feel good as new. Sweet dreams.